Hi everyone, Daryl here from Pacific Northwest Medical Group. I just wanted to do a quick video. We brought our InvisaRED system online. In some of the other videos we showed a couple of our owners, myself and my wife and a few others doing the treatments and some of our results. But now that we have some patients actually coming through and getting their own treatments, I wanted to share some of that as well. And so just a quick background on the InvisaRED. It's one of the only FDA devices out there that's clinically proven to have results. And one of the unique things that we're doing is combining the InvisaRED machine, the lipo laser, with our Styku body scanners so that the measurements that people get are done completely hands-off. They're done by the computer system so that there is what I refer to no funny business in the before and after where, you might do a very loose tape at the beginning, and then after the treatments kind of do a tight one to show that there's some actual progress. But just as another reminder, the way that these work is there's two actual light sources in this machine. There's a red light, which is good for getting to the skin level, and infrared, which can penetrate deeper into where the fat cells are. And this pulsing of the energy into the fat cells, helps energize them, make them, go through cycles and expand out their work. And so you actually burn the actual fat and the energy. And I'm just going to call out one thing real quick before we see the actual patient results. But on the left side here, this was the clinical data that they went through the FDA trials with. And so the sample size here you'll see is 800 patients. So 800 patients went through this. It was 9 treatments for each one of the patients over 3 weeks. So 3 treatments, 3 treatments, 3 treatments. And the results that they saw were patients lost about 1.75% of their body fat. They lost about a half pound per session. But over the course of the 9 treatments, they lost about 10 inches on average. The interesting thing that we noticed was, that they had a 100% success rate in the treatments. Everybody made progress. And so I've shared before some of the results that, I've seen in my wife, Jennifer. One treatment, she lost an inch and a half. My first treatment, I had lost 2 inches. Then I did a series of treatments, lost 5.2 inches. But let me bring up one of our recent patients who went through this. So this is patient MS, not using actual names to protect privacy information. But she did a series of 3 treatments on November 14th, November 15th, and the 18th. That's a Thursday, Friday, and a Monday. And so at the top of her waist, here was a measurement on November 14th. It was 34.4 inches. And after the 3 treatments, it was 32.7. So that was down 1.7 inches. And, we're not, what we're seeing here is not always going down. In the middle of her waist, it actually went up 0.1 inches over those 3 treatments. But then when you go down to the bottom of her waist, she'd lost 4.4 inches there. And then kind of at the end of where the paddles were, because for her treatment, we did it right around her abdomen area. At the top of her hip, she lost another 0.4 inches. And so that was pretty good progress just for where the paddles were around her stomach area. But she did a couple other treatments. One of the additional ones she did was she had the paddle around her neck. And so, because I think we all kind of have that little session, that turkey thing there that we want to get rid of. Over those 3 sessions, she lost 0.3 inches, which was really good. But then when we look at some of her other results, in that time span, her body fat percentage went from 38.5 to 37.8. So seeing the body fat coming down over those sessions. Her BMI actually came down as well, 32.7, 32.2. That's a 0.5 percentage drop. Just a reminder for everybody, if you're between 27 and 30, you're considered overweight. Anything 30 and above is considered obese. So she's getting down closer to getting out of that obese range. And then, in those 4 or 5 days with those 3 treatments, she actually dropped 3 pounds of weight. And so, we consider this a success. I'm going to throw up a couple more videos because as we've had some other patients go through, we're seeing similar results. This stuff is, it's working, and it's working as advertised. We don't bring things into our clinic unless they're both FDA approved. And my wife and I have done extensive testing ourselves to show that it works. And so as a reminder, people who are on our medication programs with auto billing get one of these treatments on their account every month. These treatments work best if you do series of them back to back, so like 3 in a row, 3 in a row, 3 in a row, as you saw in the FDA study. Some of our patients are getting into it now because they have 5 or 6 credits built up. And as you can see here, they're making good progress. So thanks everyone. If I don't talk to you before Turkey Day in a week or so, happy Thanksgiving. And this is Daryl from Pacific Northwest Medical Group.